Now we're going to talk about diseases and conditions of the male reproductive system. But before we do that, we're going to talk about sexually transmitted diseases, and this occurs in both males and females. Now, since the STDs are sexually transmitted, use a condom. Let's talk about chlamydia. This is spread by sexual contact. It's caused by Chlamydia trachomatis. It causes urethritis in males and urethritis and cervicitis in women. Primary infection sites are the genital area, mouth, or the anus. Gonorrhea is an infection of the genitourinary tract. It affects the mucous membranes. It's caused by Neisseria gonorrhea, and it is sexually transmitted. Trichomoniasis. This is a protozoan infection of the lower genitourinary tract. It causes vaginitis in females and urethritis in males. It's caused by Trichomonas vaginalis, and it is sexually transmitted. Women may increase their susceptibility because of their use of over-the-counter vaginal sprays or douches. These preparations may change the natural flora of the vagina such that a more hospitable environment for the parasite is created. Genital herpes. That just looks nasty. This is a recurrent infection, ulceration spread by skin-to-skin contact. It causes painful genital sores. It's caused by the herpes simplex virus 2 sexually or herpes simplex virus 1, and there is no cure. Genital warts, they're also known as condylomata acuminate. It's a genital infection. Causes raised cauliflower-like growths. It's caused by HPV, which is human papillomavirus, and it is sexually transmitted. Syphilis. This is highly contagious. It is a chronic, systemic, sexually transmitted infection. It's caused by Treponema pallidum, and it is transmitted sexually or through contact with infected lesions or body fluids. Now there's 3 stages. The first one is the canker. In the second stage, this is 1 to 2 months following infection. It becomes a chronic systemic disease that can involve any organ or tissue. It's still contagious. And the third stage, that goes from 1 to 40 years, this is called the latent period. Infection is generally subclinical or asymptomatic. Lesions called gumas have invaded body organs and systems, causing widespread damage to the point of being disabling and life-threatening. Okay, this is a canker. It's the first stage of syphilis. It's a hard ulcer that appears on the external genitalia a few weeks after the bacterial infection. It's a painless but highly contagious lesion. A chancroid is also known as a soft canker. It's a bacterial infection of the genitalia. It causes a necrotizing ulceration, lymphadenopathy, and it's caused by Haemophilus ducreyi. Now, the male reproductive system. Okay? The prostate right here. The prostate gland secretes a thick fluid that, as part of semen, aids the motility of the sperm. The muscular tissue of the prostate aids in the expulsion of sperm during ejaculation. Okay? Now, the seminal vesicles, right here, they secrete a thick, sugary yellow substance that nourishes the sperm cells and forms much of the volume of ejaculated semen. Okay? The cowper, or bulbourethral glands, also secrete fluid into the urethra, located off the urethra right before the prostate. Okay? So it'd be like right in there. Okay, the little bulbourethral glands. Then the sperm mature and become motile in the epididymis, and they are temporarily stored here. And the foreskin is the one that covers the head of the gland's penis. Now, in the testicle, right here, This is the vas deferens, and this is within the spermatic cord. They have arteries and veins inside the spermatic cord. The the seminiferous tubules, okay, these are narrow coiled tubules that they contain cells that manufacture spermatozoa. Okay. The interstitial cells of the testicle, they're also called Leydig cells, is what produces the testosterone. Okay, and then you have your efferent ductal. Okay, this carries the fluid away and the sperm away. The epididymis is approximately 16 feet long, and the vas deferens is approximately 2 feet long. Alrighty, let's talk about erectile dysfunction. This is a consistent inability to achieve or maintain a penile erection. Causes anything that impedes the nerve response or anything that alters the blood flow to the penis. Now, the urethra, right here, okay, is surrounded by the corpus spongiosum, okay? Right here, let me start over. So an erection begins with the sensory or mental stimulation or both. Impulses from the brain and local nerves cause the muscles of the corpus cavernosa to relax. Blood flows into the spaces of the corpus cavernosa. Increased pressure, and there's the corpus cavernosa right there. Increased pressure makes the penis expand. The tunica albuginea traps blood in the corpus cavernosa, which sustains an erection. Okay? When the muscles of the penis contract and stop the inflow of blood and open the outflow channels, the erection is reversed. Okay? Now, the corpus cavernosum, as they said, is surrounded by a membrane called the tunica albuginea. The two chambers, which are filled with spongy, smooth muscle, fibrous tissue, spaces, veins, and artery. Okay, this is spongy tissue, this corpus cavernosum. Now, Viagra, which is a vasodilator, increases blood flow to the penis, and it maximizes the amount of blood getting into the penis. And these are the male reproductive diseases that we're going to talk about. Common symptoms of male reproductive diseases: any urinary complaints, which are frequency, urgency, incontinence, dysuria, nocturia, etc. Pain in any of the reproductive organs or any unusual discharge. Swelling or enlargement of any of the reproductive organs. Any sexual disorder or concern, or lesions on external genitalia. The epididymitis and orchitis. Epididymitis is inflammation of the epididymis. Most common cause is sexually transmitted Neisseria gonorrhea and Chlamydia trachomatis. Orchitis is infection of the testicles. It's caused by viruses, especially the mumps virus, bacteria, STDs, and epididymitis. Torsion of the testicle. This is a twisting of the testes on its spermatic cord so that the testes blood supply is blocked. Okay, and you can see it right here that it's twisting around itself. A varicocele. This is testicular veins become abnormally distended. Okay, right in here you can see that. And you get testicular swelling. Veins contain one-way valves that work to allow blood to flow from the testicles and scrotum back to the heart. When these valves fail, the blood pools and enlarges the veins around the testicle. This causes a varicocele. Prostatitis is an acute or chronic inflammation of the prostate gland, and it's more common in males greater than 50 years old. And the last slide in this part is BPH, which is benign prostatic hypertrophy. This is a non-malignant, non-inflammatory hypertrophy of the prostate gland. It's most commonly associated with the aging process. It's common in men greater than 50 years old. As the obstruction increases in size, symptoms may include nocturia, dribbling, urinary frequency, and or a weak urine stream. And that's it.